Hello and welcome to Digestive Health 101. This is your go-to webinar for the basics of digestive health, as well as the latest and greatest in nutrition for digestive health. This webinar is in collaboration with the Canadian Digestive Health Foundation, or CDHF. It's Canada's trusted resource on digestive health, committed to providing useful, up-to-date information and research to help Canadians manage their digestive conditions and live healthier, including this webinar. There's lots of other great resources at cdhf.ca. A little bit about the company that I work with, which is NutriProCan. We started in 2015 as Nutrition Professionals of Canada and have been rebranded as NutriProCan. We're a company that specializes in nutrition counseling and consulting, including counseling for individuals as well as groups. We also do workplace wellness and senior care, to name a few of our additional activities. We are the one-stop shop for nutrition counseling. We have a whole team of dietitians that specialize in all different areas, including digestive health, as well as pediatric nutrition, weight management, diabetes counseling. So we're that one-stop shop, and we offer virtual counseling to those in Ontario, British Columbia, and Alberta. A little bit about me, your speaker today. My name is Lisa Spriet. I'm a registered dietitian with a Master's of Science in Foods and Nutrition. I am a co-owner and co-clinical director at NutriProCan. I also previously taught at Brescia University College in the Foods and Nutrition program, teaching future dietitians who some of them now work with us. We worked with hundreds of clients, personally myself, on digestive health. So it's an area that I do specialize in, that we see a lot of people, whether it's just improving overall digestive health or treating as part of the treatment for managing things like IBS, IBD. I'm also a digestive health advocate. I talk to most of my clients about poop. I'm a new mom. I love exploring new foods with my now 9-month-old, and I'm a bit of a health nut and also love traveling. So hoping to get back to that soon. All right, so this is what we're going to dive into today. So we're going to learn about why your gut health matters and how it contributes to your overall health and well-being. We're really going to dig into the basics of what healthy digestion is and what even gut health actually means. We'll get into some practical tips on improving gut function, including things to do and things maybe not to do. Our top dietitian tips for understanding gut healthy foods and supplements, as well as other lifestyle factors that are important for overall gut health. And then how do we put this all together? So some foods, some meals, some snacks, some ways of living to make sure you're optimizing your digestive or gut health. As well as along the way, we're going to have some myth busting and quizzes. So right now, I want you to stop for a minute and really think to yourself, how healthy is your digestion? Some of us go day to day with some digestive issues and don't even really stop to think about it. So here are top signs of healthy digestion and some not so great signs. So number one, having proper hunger and satiety clues. So feeling full, including morning hunger, is really important. It's a good sign of good digestion. That you can eat most foods without discomfort or pain or digestive upset. That you don't often burp unless after large meals or having carbonated beverages. That you can eat a variety of plant-based foods and fermented foods without any issue. That you're having about 1 to 2 bowel movements per day without straining, and that poop looks like a long snake. We'll talk about poop a little bit more. That you can tolerate most foods, excluding foods that maybe you have allergies to, without major issues. What are some signs of not so great digestion? So waking up feeling bloated or that you can't eat in the morning, often feeling bloated or discomfort after eating meals, having bowel movements less than once per day or having to strain for them, having urgent poops more than 3 times per day or diarrhea, having gas throughout your day or after meals, having many food intolerances, and the list just seems to keep growing. Those are signs of not so great digestion. You definitely use a tune-up. Why does gut health matter on a larger scale? Well, statistics of gut issues in Canada show that Canada has one of the highest rates of IBS, irritable bowel syndrome. We're at about 18% of our adult population compared to 11% globally. So definitely higher rates in Canada for some reason. 40% of those who suffer from IBS also have high rates of anxiety and depression. So it's not just IBS that is the issue. We know that mental health is really important, and our gut is important for overall mental health. 80% of our immune system is within the lining of our gut, and imbalances the microbiome, as well as issues with digestion can lead to autoimmune diseases such as Crohn's disease, another digestive health issue, as well as just overall poor immunity. There's also an economic burden to having digestive disorders, including time off work, as well as poor quality of life or decreased quality of life. We also know that too much of the bad bacteria, which we'll get into, can lead to inflammation and ultimately diseases such as gastritis, colorectal cancer, as well as plays a role in chronic diseases like diabetes and heart disease. Again, I want you to take 2 minutes and think about how your gut affects your life. What are some of the digestive functions that might affect you? Well, if you're getting sick often, so it helps to support your immune system, for example, fighting off colds. If you're having feelings of anxiety or depression, we know that changes in the gut microbiome can lead to anxiety or depression. Probiotics may affect your risk of heart disease, as well as your body weight and skin health. We have lots of research in this area, especially around body weight and your microbiome. We know that altered gut health can lead to feeling socially isolated, uncomfortable, and even sick. So do you ever kind of say to yourself, will I have enough options to eat when I go out? Well, maybe I won't go out then if I don't have enough options. Or will I have to take time off work again? Can I not leave my house in the morning? So think about how your digestive health affects your life. Something that I want to talk about before we dive into the basics of digestion is prevention versus treatment. So prevention is promoting good gut health. The prevention of different digestive disorders, as well as maintaining healthy digestion by incorporating healthful diet and lifestyle. This is what we will be discussing in this course, in this webinar. We're not so much going to be discussing treating gut health problems. So treating gut health is alleviating the adverse effects of many gut disorders such as IBS, IBD, and GERD. It's also called medical nutrition therapy, and it's used oftentimes with other modalities. In terms of treating diseases, we are not going to be discussing in detail treatment of digestive disorders. Again, we're focusing on that overall improving digestive health, promoting digestive health. And I also want you to keep in mind that what is good for maintaining gut health might be very different than what is good for digestive health issues. So quite often, things that are good for promoting overall gut health are actually things that we would not do or we would advise against if somebody does have a digestive health disorder. If you do have a digestive health disorder, please continue to listen to this webinar, but then also reach out for some more personalized help for your case. Okay, so we talk about gut health or digestive health, and what are we even talking about? What does it include? Is it just our stomach? Is it just our intestines? Well, the digestive system is very intricate, and there's actually 5 main parts or steps that go on in terms of fully digesting our foods. So the 5 stages are ingestion, or taking food into our body; digestion, breaking down food; absorption, moving food from inside our intestines to inside of our body, or moving into our cells; assimilation, making use of those foods and making them part of our cells; and then elimination, getting rid of the things that we no longer need. We're going to be talking about ingestion, digestion, absorption, and elimination. And as you can see, there's a lot of organs involved in digestion, everything from our mouth and oral cavity and uvula to our liver and gallbladder, small intestine, stomach, large intestines. We're going to be talking about all of these. Okay, let's start with digestion. So this is taking the food that we eat and making it ready to be absorbed. There's 2 major parts to digestion. There's mechanical digestion and chemical digestion. They're happening throughout our digestive tract. So mechanical digestion starts in our mouth. So that's when we first start digestion. So that's the crushing, mashing of food that we've consumed. It also continues in the stomach when food is churned or mixed around with muscular movements in our stomach. And then we also have chemical digestion that actually starts in the mouth as well. So this is where large chemicals are broken down into nutrients that can be absorbed through the help of enzymes. This starts in our mouth. So You're probably familiar with saliva that we release. We actually release an enzyme called salivary amylase that helps to break down the carbohydrates. It's the first step of carbohydrate breakdown. And then it continues in our stomach with stomach acid. We release hydrochloric acid, very, very acidic. A few rules to hydrochloric acid release. And then it finishes in our small intestines, where there's lots of different enzymes, both from the lining of our small intestines as well as coming in through our pancreas. And then we have absorption. So absorption of our nutrients occurs mostly in the small intestines. However, there is some absorption through the stomach and large intestine walls as well. When we think of our small intestines, I want you to think of it almost as a fence with gates. So it's a long, long, long fence, meters long, with these gates along the way. So the fence is supposed to prevent things from getting in, and then the gates allow certain things to get in. When they get in, that means we're absorbing them. If you don't have a ticket for a specific gate, then theoretically you should not be getting through. When the gut lining is compromised, however, there's holes in the fences, things can sneak through that shouldn't be getting through, and the gates aren't working properly, and they might not let in certain things or let in things that they shouldn't be letting in. Things like this would be whole proteins, which can lead to allergies, as well as pathogens that can then make us sick. All right, and then we have elimination. So again, not going through assimilation, but let's move on to elimination. So this happens in the large intestines, which is also known as the colon. There is a little bit of absorption here. So we do absorb some water and some salts, but really the main role of our large intestines is concentrating that poop as well as then eliminating it from our body. As we'll talk about though, there's other really cool stuff going on in our large intestines. So we also have these muscular contractions going on that helps to eliminate the poop from our body when we need to. Now let's do a little introduction to something that's going to be a theme through the rest of this webinar, and that's gut health and the microbiome. So our guts, including our stomach and intestines, and small and large, but mostly large, are the major site of immune activity. So we have a few things going on. So stomach acid kills the incoming bacteria. As I mentioned, we release hydrochloric acid. So this is kind of our first crack at destroying bacteria that we might be consuming. The microbiome helps to fight off unwanted bacteria and invaders. Think of it as they want to keep their land. They've populated our intestinal tract and they don't want these bad guys coming in, so they fight them off. It's also the major site of activation of immune activity. Our gut actually has its own immune system. So as I mentioned, getting sick often, this is where we see it tied to. Also, it's responsible for absorbing nutrients that our immune system needs to work well. So if we don't have good gut health, we don't have a good overall good immune system because we're not giving it the nutrients that it needs to work properly. Our microbiome is made up of trillions of microbes, mostly living in our intestines. However, I want you to keep in mind that we also have them in other organs such as our skin and our mouth. We're going to be talking about probiotics or bacteria. However, there are other types of microbes that play a really important part in our overall digestive health. Another key thing we're going to be talking about is pre and probiotics. So we've probably heard these terms before, but maybe nobody's explained exactly what they are. So probiotics are the bacteria that live in our digestive tract and they offer beneficial, so health effects. So they're made of these good bacteria and they help to fight off these bad bacteria, as I mentioned, as well as restore overall balance in our body. What are some sources of probiotics from our food? So yogurt, things that have been fermented, kefir, sauerkraut, kimchi, kombucha, miso, tempeh. So foods that have been fermented, and that fermentation process is completed by the bacteria, and then we consume that bacteria. However, just like feeding your garden, we need to make sure that we're keeping our probiotics in our body healthy. And this is achieved through prebiotics. So prebiotics are type of fibers that help to feed our microbiome. So our own digestive enzymes aren't able to break down these prebiotics, these fibers, but our gut bacteria are, and they ferment them and use them for food. So they help to maintain healthy colonies of bacteria. They induce the growth of the beneficial organisms, such as bacteria. Some sources that we're going to be talking about include things like whole grains, bananas, greens, such as kale and spinach, onion, garlic, soybeans. We'll be talking about many more as we go along. They contribute to digestive health and are important for maintaining a balanced immune system as well. So not only do we need it to get in probiotics, do we need to get in these prebiotics to help keep them healthy. So what are signs of a healthy gut? When we look at things in the clinic, what are things that we're looking for? So first of all, diversity. And this is a really key concept for digestive health is diversity. And this is talking about the number of different species in your gut microbiome and how evenly spread out they are. And there are some cool tests now that you can do to measure your gut diversity, not that it's needed. Having regular bowel movement, so pooping 1 to 3 times a day is within the normal range. Less than that can be considered constipation. More than that can be considered diarrhea. So what can happen with constipation? Stool is sitting around too long and the not so great bacteria can start growing. If we have too fast digestion, if we have diarrhea, then some of those healthy gut bacteria might be wiped out of our intestines. Lack of gastrointestinal disease, so making sure that people have been screened or tested for things like IBD or inflammatory bowel disease or Crohn's or colitis or maybe celiac disease, gluten intolerance. Proper immune function, so absence of allergies or autoimmunity. Being free of rectal problems such as hemorrhoids and symptoms such as gas, bloating, and abdominal pain. So those are signs of healthy gut. Other things that we look for that we know are connected to gut health include things like having clear skin, free of rosacea, rashes, and acne, having good mental health. As I mentioned, depression, anxiety are very much related to our gut health, and being in control of food cravings. There's many factors that affect our overall digestive or gut health. Things like general lifestyle, which we'll touch on briefly, sleep, exercise, host genetics. So your genetics, we see that there are genetic differences in digestive health, including genetic related digestive health disorders, as well as our microbiome. Early colonization. So what did you get from your mom? What did you get from your childhood growing up? Medications, antibiotics, we know have a really big effect on overall gut health. Did you have them a lot when you were little? And then what populated your gut after we killed off the bacteria with those antibiotics? Other health or diseases. So obesity can affect your gut health. Diabetes can affect your gut health. And then what we're going to really focus in on is diet. So dietary patterns, and I want to point this out as being really important. We will be talking about specific parts of the diet, but it's really about the pattern, what you eat on a regular basis that matters. So we know that the Western diet, so the westernized, higher processed food, lower fiber diet does really have a negative impact on overall digestive health. We know that vegetarian diets or plant-based diets that are high in these fibrous plant-based foods are actually beneficial. Some specific foods that we will be talking about, things like whole grains, fruits and nuts, vegetables and legumes, as well as those specific constituents of the foods, including fiber and carbohydrates, fat, protein, phytochemicals. We'll be talking about all of these. And then those food-associated commensal bacteria, microbes, so our probiotics that we're consuming. Okay, so let's dive in further. So these are the different topics that we're going to go through in terms of eating for gut health. Starting with fruits and vegetables. And fiber, which we'll talk about in terms of fruits and vegetables, whole grains, legumes, as well as those prebiotic foods. So fiber is the superhero of gut health. Why? There's a few reasons. So what is fiber? It's a carbohydrate that is found only in plant foods, so not found in animal foods. And it's something that our bodies on their own can't digest or break down. What are the different types of fibers? Well, there's 2 different types. There's soluble and there's insoluble. Soluble attract water, absorb water, form a gel, and they're easily fermented. So really good for our gut bacteria. Insoluble fiber attract water, but can't really be fermented that well. So what's the purpose of them? if they're not being digested by our gut bacteria, well, they actually help in leading to softer stools and can help reduce the risk of hemorrhoids and constipation, as well as colon cancer. So getting both soluble and insoluble fibers are really, really important. Why are they important? Well, the soluble fibers, as I mentioned, they can be fermented, and they produce something called short chain fatty acids, which provide fuel to our colon cells or large intestinal cells to keep them healthy. The short chain fatty acids also have a myriad of other effects in our body as well. And then, as I mentioned, that insoluble fiber helps to keep our digestive tract flowing. So what are some sources of soluble fiber? I want you to keep in mind, as I'm mentioning these things, that whole foods, plant-based foods, contain a mix of both soluble and insoluble, but some have more soluble and more insoluble. So soluble, barley, oats, nuts, chia seeds; insoluble, whole grains, corn, beans, fruits with the skin on are good sources of insoluble fiber. Okay, fruits and vegetables. So why are these important? They provide fiber, both soluble and insoluble, and antioxidants. So antioxidants help to keep, so these are phytochemicals or plant chemicals that help to keep our microbiome healthy. They also help to reduce inflammation of the gastrointestinal tract. So what are some of the key ones that we want to include? Things like banana, apple, grapefruit, grapes themselves, pineapple, and blueberry, really great sources of both soluble and insoluble fiber, as well as those phytonutrients or antioxidants. Vegetables, leafy greens, all leafy greens, spinach, kale, collard greens. Broccoli is a really great one for both insoluble fiber as well as antioxidants. Romaine lettuce, really all fruits and vegetables, whole fruits and vegetables. I'm not talking about the juices here because they wouldn't have the fiber content, are really great. We often get asked how much people should be consuming. The research really shows that the more better. So there is no absolute level that if you eat this much, it's optimal for gut health. Start with at least 5 servings per day and try to increase from there. What I want to point out about this picture as well is the diversity of different colors. We have some research showing that more than 30 species of plant products per day should be consumed for overall digestive health. So when you're making a plate of vegetables or salad, get every color in there. You'll get different nutrients, different types of fiber, and different types of antioxidants as well. Complex carbohydrates. So what are these? These are starches and non-digestible fibers that help to feed our gut bacteria and keep them healthy. Two ones that I want to point out are whole grain and starchy vegetables, as well as legumes. So whole grain and starchy vegetables, these are really the biggest part of fiber in most people's diets. They include things like whole oats, brown rice, quinoa, buckwheat, whole grain breads. You want to look for whole grain, as well as these starchy vegetables, sweet potatoes, parsnips. A lot of our root vegetables would be starchy vegetables. How much should you be consuming? Depending on your energy needs, somewhere between 3 to 6 servings per day. And one serving is about half a cup cooked. Going beyond that might be beneficial for you as well. Another really key food, as I mentioned, for complex carbohydrates and protein, which we'll be talking about, are legumes. So these are things like kidney beans, chickpeas, lentils, black beans. They provide both soluble and insoluble fiber, as well as some antioxidants. How much? Well, the research does show that, again, the more you consume, the better. But if you can start with half a cup 2 to 3 times per week, you can see some benefits to your digestive health. Keep in mind, when you do start increasing your fiber intake, for some people, it does cause a little bit of gas until your microbiome adjusts. So start slow. If you're not having any whole grains or any legumes, maybe start with 1 serving per day and then increase week to week. On to healthy fats. So these aren't necessarily a source of fiber, but we do have a lot of research looking at the amount of fats and the different types of fats and overall gut health, as well as health of our microbiome. We know that high saturated fat diets have been shown to alter the microbiome and predispose people to digestive disease. So specifically saturated fat, which we get from animal products, including high-fat dairy, red meat, as well as coconut products like coconut oil and processed palm oil that we find in a lot of processed foods. We know that they diminish our gut microbiome and overall not great for our gut health. The ones that we want to focus on are unsaturated fats. So things like our monounsaturated fats, think of nuts and seeds and olives and olive oil. Our omega-3s, think of fish, chia seeds, flax seeds, and omega-6s. A lot of our nuts and seeds, as well as soy, can be very beneficial. We have research to support that these are great for our overall gut health. So again, sources: olive oil, nuts, seeds, fish oil. They should be a regular part of our diet. On to proteins. So lean proteins and plant proteins versus fattier meats or proteins. So the benefit really here to having leaner proteins and plant-based proteins are twofold. So plant-based proteins, you're not only getting protein, but you're getting those different types of fiber. And then lean protein, those are lower in saturated fat. And as I just mentioned, saturated fat is not great for our gut health. Eating plant-based proteins also helps offset the impact of high protein diet on gut bacteria. So we know that a very, very high protein diet probably isn't great. A moderate protein diet coming from plant-based foods and lean proteins is great to do. We also know that red meat consumption can lead to increased gut production of a compound that's responsible for increasing cholesterol levels. So this might be one of the connections there between saturated fat content of our foods and cholesterol levels is actually the red meat. We also know that high saturated fat diet can decrease biodiversity, not a great thing. So not only just decreasing the number of healthy bacteria, but also that biodiversity, which is really important for overall gut health. So focusing on lean protein and plant-based protein is better to do. Okay, our first little quiz question. Should everyone supplement with a probiotic? So there's so many different probiotics on the market. You see them being claimed for helping almost every condition. So what do you think? Should somebody supplement? No, depends on needs, or should be for a specific purpose. It's really B and C. So it depends on somebody's needs and it should be for a specific purpose. So if somebody does have digestive health issues and maybe they can't consume foods with probiotics in them, then perhaps yes, but it needs to be specific. So there's tons of different bacteria that have been shown in research to be good for different disorders or different needs. So it needs to be personalized for that person. Okay, let's move on to the spice of life, herbs and spices. Not only do they make food taste good, but there are specific ones that can help with digestion. So one really important one is ginger. So we know that ginger can also be anti-inflammatory, which we'll talk about, but it actually aids in digestion. And there's lots of supplements out there, but you can also just chew on ginger root after meals to help with digestion. Reducing inflammation. So this reduces inflammation throughout our body, including reducing inflammation in our digestive tracts. So things like turmeric, which we see in a lot of curry spices, and ginger, really good for reducing inflammation. There's some specific spices that have been shown to help with gut bacteria, including bay leaves, oregano, cloves, and cinnamon. They are delicious and they really help to promote that healthy gut microbiome. Okay, on to our next couple myths or facts. So common questions we got. Chewing gum will sit in your stomach for many years. This is in fact a myth. While it's insoluble, meaning that we can't digest it, it does not mean that it sits in our stomach indefinitely. So it does eventually pass through in our stool. We can move it through our digestive tract without absorbing it, and we just lose it in our stool. Next one, twice as many women suffer from digestive health issues on a weekly basis compared to men. This is actually a fact, and we see this in the clinic as well. And this is partly due to high levels of estrogen and progesterone that we see in women, so the female sex hormones, and they interfere with the gut. They can slow down motility. So again, that's the movement of food products throughout our body, which affects our overall gut health as well. So it is true. We work with people in the clinic, though, to help offset that. And sometimes we need to eat a little bit differently during times of high estrogen or progesterone versus other times. Okay, this brings me on to potential supplements, another really common question that we get. So these are some supplements that have some good research that are generally safe and can help with digestive health. So peppermint oil. So there's really good research to support that can ease abdominal pain. If you do have gastroesophageal reflux, be careful with this one, but overall, it's really good for those with IBS. Turmeric, as I talked about, good for so many things, but also good for the growth of our beneficial bacteria and reduction in harmful bacteria. We then have ginger, as I mentioned. So we can eat that as a spice, but you can also take ginger supplements and they can help with ease with digestion. Bromelain, this is an enzyme that's taken from pineapples and it helps to reduce heartburn. The lactase enzyme, so this is for people who have lactose intolerance or can't digest the sugar that we find in lactose, the sugar that we find in dairy products. You can take this supplement and it acts to break down that lactase enzyme and helps you to digest dairy products a little bit better. Again, these are potential supplements, not ones that everybody should take. You should really speak to a health practitioner first. Okay, our next true or false. The more fiber you consume, the better your digestion. From everything I've said so far, you would probably think that this is true. The answer is false. And this is because if we include more fiber and we don't include water or hydration as well, it can actually lead to additional digestive issues. So our last kind of nutrient that we need to talk about is water or hydration. So in addition to increasing fiber, we have to increase hydration. So drinking adequate amounts of fluids, especially water, is important for healthy immune system. We already know this. It helps with regular bowel movement, so it keeps our stool a little bit softer to help prevent constipation. It also helps in breaking down our food. So our enzymes that I mentioned need aqueous solutions. They need to be in water to work properly. How much should we have? Well, minimum of 2 liters of plain water per day. Try to limit sugary drinks, as well as fruit juices. We know that these are not great for gut bacteria. And then also, the more fiber you consume, you should increase your hydration levels from there. So start with that 2 liters and then an additional 500 mils or 2 cups for every additional 5 grams of fiber that you consume through your diet. Okay, true or false? Foods with lectins destroy gut health and should be limited. There's been a lot of back and forth about this in the last few years. We hear that people are avoiding legumes and whole grains to avoid lectins. So is it true? It's actually false. So whole grains and legumes do contain this compound called lectins. Lectin is an anti-nutrient, meaning that it inhibits the absorption of certain nutrients in our body. However, whenever we cook legumes or whole grains, as we do, or process them as we do in order to be consumed, it reduces the lectin levels down to be very, very insignificant. And there is zero research that consuming these foods has a negative impact on gut health for those with overall good digestion. That does, however, bring me to foods that we do need to limit for overall gut health. As I mentioned, red and processed foods, they're devoid in fiber. And again, that carnitine compound of red meats we know is not good for digestive health, not good for our heart in terms of cholesterol levels. So these are things that we should limit as much as possible. Refined carbohydrates, so this could be things like white bread, baked goods, croissants. They weaken their beneficial bacteria because they are low in fiber, so they don't provide those prebiotics. Processed foods, for the most part, tend to be higher in saturated fat and lower in fiber. We know that processed foods can lead to the destruction of gut bacteria. So this would be things like saturated in trans fats. So these increase the number of harmful gut bacteria and decrease the number of helpful gut bacteria. So this would be things like, again, red meat. Trans fats foods would be mostly processed foods. So limiting those again, we seem to find a theme here. Sugary beverages, pop, juice, they weaken that gut bacteria. They don't provide our bodies with fiber. Alcoholic beverages, So up to 1 drink per day for women and 2 drinks per day for men can be okay, but we know that alcohol in itself can lead to inflammation of the digestive tract as well as changes in the gut microbiome and increase your risk of various different digestive health disorders as well as digestive cancers. All right, let's move on to some great tips as well as how we actually tie this all together. So here's our top tips for eating well, both at home and at work. So bring a lunch from home. Pack your lunch every evening for the next day. Even if you're still working from home, you can pack your lunch and leave it in the fridge. Get into the habit for the days that maybe you do have to go back to work. This will help to reduce the intake of those processed and fast foods. We'll talk about what some lunch options are. Keep smart snacks handy. So examples like turmeric muffins. And we do have some recipes for this if you want to connect with us. So maybe some whole grain muffins that you're adding some turmeric to. They add a really cool color that kids like as well. Bananas are great, and almond butter on the bananas are delicious. Make time to eat. So this is part of the mindful eating. Put breaks in your day. Take a lunch break. Make sure it's something that everybody else is doing. At home, set the table, sit down, and eat mindfully. Chew your food, pay attention to what you're doing. It helps with digestion. Eat with others in your social bubble. So we know that sharing meals with others actually can promote good digestive health. We tend to eat a little bit healthier and actually sit and pay attention to what we're eating. It's also good for our mental health too. Okay, so what does a gut healthy day of eating look like? So here are some options for breakfast, lunch, dinner, and snacks that we'll go through. So for breakfast, overnight oats. So this includes oatmeal and maybe some berries in there, which are both really great sources of fiber. You could make a yogurt and chia pudding bowl, which would be a great source of fiber, some lean protein, as well as probiotics. Cottage cheese ricotta toast that you could do on a whole grain bread with added prebiotics. You get some lean protein from the cottage cheese as well, instead of using the higher fat ricotta. And then some healthy fats in there. You could put some chopped avocado on top or sprinkle with some nuts and seeds for some additional fats. Lunch and dinner ideas. So these are interchangeable. Kimchi, which contains both probiotics and prebiotics. So that's a fermented cabbage with buckwheat noodles. So whole grain buckwheat has some prebiotics. With shrimp, lean protein, edamame, that lean protein, as well as the prebiotics and antioxidants in there as well. Asparagus and avocado salad. So it's a nice, and a ginger miso dressing. So ginger we know is good for gut health. It's anti-inflammatory, helps with overall digestion. And miso is fermented soybean paste that has some probiotics as well. Spaghetti squash instead of regular spaghetti is very, very high in fiber. It's a great prebiotic. And do a lentil tomato sauce instead of a beef tomato sauce, reducing saturated fats, increasing our prebiotic intake as well, or fiber intake. Some great snack ideas. Make some seed crackers with things like hemp and chia. They provide healthy fats with probiotics and fiber. Matcha balls. So you could do some oats with almond butter. Matcha, which is a green tea powder, very anti-inflammatory. So great for prebiotics as well. Peach and mango kefir smoothie. So just frozen or fresh peaches and mango, great source of antioxidants and fiber. With kefir, which is a really potent probiotic. It's a fermented dairy product. All right, so those are our top tips for nutrition. Let's look at other considerations for gut health. Exercise. We have really great research to support that both cardiovascular as well as weight-resistant physical activity is really good for overall gut health and microbiome. So things like cycling or walking or weightlifting. We also know that yoga and stretching can help with moving foods through our gastrointestinal tract, so having regular poops. Stress. So there's a negative impact on stress on our gut microbiome, as well as our digestive enzyme releasing capacity. So try doing breathing exercises each day, doing some mindfulness or meditation, as well as massages. Sleep. Lack of sleep can cause a myriad of digestive disorders or contribute to them, as well as actually has a negative effect on our gut microbiome. So aim for 7 to 8 hours per night. Alcohol, we sort of mentioned, it can inhibit the production of good bacteria as well as lead to inflammation throughout the digestive tract. So maximum 1 drink per day for women, 2 for men. Try to stick with red wine because then you're getting some antioxidants as well. Limit those sugary drinks. Smoking. So there is no amount of smoking that is good for digestive health or okay for digestive health. It can contribute to heartburn and peptic ulcers. So just try to avoid it as much as possible. Okay, so how do we tie this all together? We know that gut health is important for elements of healthy daily life. It helps to improve our mental health, as well as just how we're feeling, as well as our immune system. We know that pre and probiotic foods are crucial for gut health. And as such, it's important to consume a lot of fiber through these various foods, fruits and vegetables, whole grains, legumes, in addition to making sure we're having enough water. Limiting processed foods as well as red meats are really important for gut health. So making your own lunch, making your own dinner, not eating out as much. And then we have those other lifestyle habits that are super important. Once you kind of nailed all of these things, we do know that there are some supplements, whether they are herbal or probiotics, that can provide a little bit of extra support where appropriate. Make sure you're talking to a healthcare practitioner before taking any sort of supplements. So how do you get more health? The Canadian Digestive Health Foundation is a great resource. They have webinars like this one, as well as patient handouts, and they can help to connect you to dietitians like us. So you can also connect with us directly at our website or email us support@NutriProCan.ca. We offer, again, a whole slew of different nutrition counseling including digestive health, as well as weight loss, hormone health, diabetes, cholesterol, pediatric nutrition, genetic testing. You don't need a doctor referral, though we do appreciate physician referrals. We are regulated healthcare practitioners, and our services are covered by many health benefits that you might have through your work or school. And keep in mind that we are more than just meal planning. We will help you meal plan, but we also help you to set goals. Then we provide additional education. We help you overcoming barriers and coach you along the way as we're making these lifestyle changes. Another resource that we use with our patients, with our clients, is from CDHF, and that's the My IBS app. It's free. It is wonderful tracking symptoms as well as looking at specific foods if we're doing low FODMAP eating. There's great resources and handouts through that app as well. You can find it at the App Store or Google Play Store. Again, that's My IBS. Here are some of our wonderful resources specific for digestive health. So you can connect with us one-on-one, but we also have some great blogs on what diet might be best for IBS, probiotics and prebiotics if you do want some more information there, as well as low FODMAP eating for digestive health. All right, so that brings us to the end of the webinar, but we do have a couple minutes and we had a few questions submitted. So I'll answer those questions. Do probiotics provide effective support to IBS? So the answer is yes, but it depends. There are specific strains of probiotics and supplements on the market that have been shown to help with IBS. However, it's not a one-stop cure-all. Quite often we have to do things like low FODMAP eating or other dietary changes to help with IBS or irritable bowel syndrome as well, but they can be helpful. How often should I be going poop every day? So this is a great question that we talk to clients about. So again, that 1 to 3 times per day, but also in addition to that, we need to look at the texture. So it should be like a soft snake, not hard lumps or liquid. So it's really important. Your poop is a great marker of what's going on in your digestion. And then what are some helpful tips for constipation or diarrhea? So definitely speak with a healthcare practitioner. In terms of constipation, additional fiber and additional water and movement is really important. For diarrhea, quite often we have to do some additional testing just to make sure that there aren't any intolerances or allergies going on. Doing low FODMAP approach to eating as well as probiotics can be really helpful for those with diarrheal type IBS or diarrhea in general. And last question, how can you find a dietitian in Canada? So Dietitians in Canada is a great association that you can connect with dietitians. Again, you can connect with us directly, NutriProCan.ca. And if you're not in one of the provinces that we service, we can help to connect you perhaps with a dietitian that is. So that's it for me. I hope you enjoyed this webinar. We would really appreciate your feedback, as well as if you would submit topics for future webinars that you would like to see. So stay well.